It's Wednesday morning, and RFK Jr.'s campaign to kill as many American children as he possibly can continues. I'm watching a live hearing in front of a Senate subcommittee where former CDC senior staff, including Dr. Manz, who was the former handpicked CDC director, handpicked by Donald Trump, who was only in that position for a month before RFK Jr. fired her. She testified that she had a meeting with RFK Jr. on, I think it was either August 25th or July 25th, where he told her that he needed her to rubber stamp the firings of a whole bunch of scientists. She refused to go along with that. She then testified that he instructed her to rubber stamp the findings coming out of the next meeting of ASIP, the CDC's Advisory Committee on Immunization Practices. That meeting starts tomorrow. He told her a month or two ago that he needed her to rubber stamp the outcomes and recommendations of that 2-day meeting a month or two before that meeting had actually happened and before she had seen any of their decisions or the data supporting those decisions. She refused to do that as well, and so he fired her. He told her that he was speaking for the president in letting her go. And the Advisory Council on Immunization Practices, a few months ago, RFK Jr. fired every single person on that advisory council and replaced them with a bunch of anti-vax cranks like Dr. Robert Malone. Google him. That's a rabbit hole you don't want to go down. And the testimony that these scientists are giving paints a very clear picture of RFK Jr. as an absolute fucking lunatic. He is not a doctor. He has no medical education. He has no medical training. He has no scientific education. He has no scientific experience or training. He's an environmental lawyer who doesn't like vaccines. And I was reminded, anybody who's followed me for a while knows that I'm a big fan of The Bulwark, thebulwark.com. And recently, over the last few months, they added a new columnist to their roster, a guy named Jonathan Conn, Cohn, who does really amazing and in-depth reporting on healthcare in the United States, whether it be healthcare policy, Medicaid cuts from the big beautiful bill, or things like this. He put out an article yesterday, and I'm going to read the first few paragraphs of it. It's called RFK Jr.'s Crusade Against Vaccines Hits Its Action Phase. His anti-vax stacked advisory committee is expected to revise rules for life-saving hepatitis B vaccine. Reading from the article, hepatitis B is a highly transmissible blood-borne disease that's been called a silent killer because it can become chronic without presenting symptoms for many years until one day it leads to cirrhosis of the liver or liver cancer or both. In the 1970s, arguably no state faced a higher hepatitis B threat than Alaska, where the virus had exploded within its native population. The infection rate in some tribes was as high as 15% at a time when the national rate was no more than 1%. The toll was devastating and included children who had contracted the disease at birth or during infancy, usually from their mothers or adults in close contact. In worst cases, the infected would die from liver cancer before reaching adulthood. Brian McMahon, a physician who treated some of those cases, told me on the phone that one particular patient, an 18-year-old 4.0 GPA with a full ride to University of Alaska, she wanted to be a teacher. She kept having stomach pains, the doctor said, but put off a doctor visit. Finally, 2 weeks before she was supposed to graduate, she came in to see me. She had a big mass in her liver. I biopsy tested her for hepatitis B. She was positive, and it was also liver cancer. And so I sat with her 2 weeks later when she died a horrible, painful death, and I will never forget that. Hope finally arrived in the 1980s in the form of a highly effective, easily produced vaccine, uh, which eradicated hepatitis B. The results were dramatic. Alaska's hepatitis B rate plummeted. Symptomatic cases among children within the tribes effectively disappeared. The success of the hepatitis B vaccination in Alaska got the attention of federal health officials, including people on ASIP, the Advisory Committee on Immunization Practices. In 1991, ASIP recommended hepatitis B shots be given to the entire population, with the first of 3 doses administered right after birth in order to protect newborns. Acute hepatitis B cases among children have fallen by more than 99% nationwide, with rates declining among adults as well. The campaign against hepatitis B ranks as one of the most important public health accomplishments of the past few decades, as the CDC's own website proclaims. But that achievement is now in serious jeopardy thanks to Robert F. Kennedy Jr.'s crusade against vaccination. That unraveling could start as soon as tomorrow. That's because ASIP is holding a 2-day meeting in Atlanta starting tomorrow on Thursday the 18th. And hepatitis B, that vaccination is on the agenda for day 1. Kennedy and his allies have long objected to the hepatitis B vaccine recommendation, especially for newborns, as well as to state and local mandates that school children get the shot, because they say the risks they believe the vaccine poses don't justify the benefits. In June, RFK Jr. claimed without evidence that scientists had covered up proof that this particular vaccine leads to autism. It's widely speculated that RFK Jr. and his new Advisory Council on Immunization policies are going to remove this vaccine requirement for newborns. If you get hepatitis B as a newborn, it leads to a long and painful death. And anti-vax cranks and RFK Jr., who has absolutely no qualifications in this field or any other medical field, they're gonna kill as many American children as they possibly can. And the Maha movement thinks that's amazing as they sit around and drink raw milk with their preschoolers. These people are fucking crazy, and they are absolutely dangerous. And they are now in charge of America's healthcare and vaccine protocols and policies and programs for everybody in this nation. And they want to basically eradicate vaccines, including another attorney who's not a doctor, who works for RFK Jr., who wants to rid the nation of all COVID vaccines, as well as the polio vaccine. And that's what Dr. Menera's, this is what she refused to rubber stamp beforehand without data, without science, and so RFK Jr. fired her. These people are fucking dangerous.